We're going to be joined in just a moment by Steve Malzberg, who is the host of the Steve Malzberg Show, the website Malzberg, Malzberg, talk.com. Steve is a conservative talk show host. And any minute now. Oh, he's just coming in. Okay, he's introducing me. I'm introducing him. And we're simulcasting the shows. So my show and Steve's show will both be on the air at the same time for the next 7 minutes or so, 7.5 minutes. It should be very entertaining. And Steve is about to join us. In fact, why don't you just pot him up if he's
Hello, Tom.
Hey, Steve.
How are you? That was easy. How are you?
Indeed. I'm fine. How are you?
Good.
Okay, so we have the World Bank saying every country in the world should have a universal health care.
Yeah, I know, but I told you guys I don't want to talk about the World Bank.
And you've got the Pope saying, we have an obligation. Pardon?
The World Bank is a snooze fest. Who wants to hear about that? Who cares?
Well, let's talk about this principle of a national health care program, of every person having health care. There are really two issues here, aren't there? I mean, isn't there the issue of, okay, you broke your arm, what are you going to do about that? All right, the individual, somebody got sick. But then there's the issue of, if you're walking down the street or if you're taking the bus someplace and the guy next to you is coughing, do you really want him to have tuberculosis? Because he doesn't have insurance?
Okay, all right. Well, first of all,
it's
I don't
public
know what
health
country
issue.
you're in or what country the World Bank is worried about, but people in the United States don't get tuberculosis.
Actually, we have two tuberculosis hotspots in the United States, Steve, Los Angeles and New York City.
Okay, well, there's a reason for that, too, because we have a lot of illegals in both those places, I'm sure.
No, actually, that's not the largest part of the population.
Okay,
it's poor people.
The largest part of the population, but let me finish. Nobody's denied medical care in this country. So, period. The end.
Emergency medical
care. In an effort to sign people up so that you could claim, we have universal health care coverage, which is never going to happen because people aren't signing up and they're not going to sign up. You're screwing with the insurance that over 100 million people have and like and depend on and can afford. That's going bye-bye. Did you see the CBS story? They finally said something I've been saying for weeks. Wait till these people who get subsidies on their premiums and these young people who could get it for $30 a month, wait till they learn the word deductible. You see, they're talking now about $5,000 plus deductibles for the average policy on Obamacare. No one could afford that. This is a disaster, Tom, a disaster.
So you're saying, Steve, that we should be giving everybody health insurance that has no deductibles. I agree with you.
No, I'm saying let the free market reign and keep it the way it was. But
so you're saying that 47 million people having no access to health care.
Be able to shop across state lines to other states and let people all over the country, insurance companies compete for the services of people in every state. Free market will solve all this. It always always will.
Like it magically has. That's why we've had such great health care in this country all these years.
Health care in the world. And you talk to the 100 million who are going to lose it in 2014, and they'll tell you, guess what? The latest polls show that 70% of Americans like their insurance, want to keep their insurance, like the liar-in-chief said we could, but we can't. Because he knows, and I guess you too, Tom, know what's best for all of us. So you, Tom, will have maternity coverage. Isn't that lovely? And you'll pay for it whether you like it or not.
I thought this was a basic principle of insurance that everybody's in. Either everybody's in or they're not. I mean, that's why it's called insurance as opposed to a 401k.
Everybody's in or they're not. That car insurance is everybody has a car insurance whether they have a car or not. What are you talking about?
Well, I don't have a car, but all of us.
Well, I don't need maternity.
All of us, to the best of my knowledge, have a body.
But I don't need maternity coverage, but I'm being forced to get it.
And women are being forced to cover prostate cancer, and they don't have prostates. But so what? We just have each other's backs. That's all.
That's insane. I mean, that's the most ridiculous.
You actually don't have maternity coverage, Steve. If you showed up at a hospital saying, "I want to see a gynecologist because I think I'm 4 months pregnant," they would laugh you out of the hospital.
No, you're paying. The policies that are being canceled are going to be canceled, especially the $100 million with the employer mandate in the next year, or the 6 or 7 or 8 million that have been canceled. They've been canceled because they don't meet all of Obama's standards, and that means everybody has to have coverage for drug rehabilitation. Everybody has to have coverage for maternity.
Well, wait a minute. You want unrehabilitated drug addicts running around on the streets loose?
No, I don't want to have to pay for rehabilitation coverage for myself or my family if we don't need it. You know what? If I had a 67 Chevy,
so I'm guessing if you don't have kids, you don't think you should pay for schools, right?
Tom, would you pay for collision on a car that was worth $100?
So are you saying, Steve, that if you don't have children, you shouldn't have to pay property taxes to cover the cost of the local school?
This is what I love about the left. What are you talking about?
You just said because your
address, and then because you can't come back with a cogent response relating to that issue. You say, "Oh, so you're saying in China, if they sit on the park bench?"
No, you're saying if you don't need something, you shouldn't. You just said if you don't need something, you shouldn't have to pay for it. So I'm saying, okay, let's apply that to schools. Are you saying that if you don't have children, you shouldn't have to pay property taxes for your local schools?
Property taxes go for many different things.
Okay, should you be able to deduct the school portion of the property tax?
System of health care in this country where 2/3 or more of the people liked.
My point, Steve, is that the public schools and the public health are the same issue.
And now the entire system is unworkable thanks to the big hand of government, who are forcing people to take what the government says is best for you.
Right, from for-profit companies. Steve, I'm with you. That's why I'm saying let's take Medicare, which operates on a 3% overhead system, as opposed to 20 or 25% overhead for all these for-profit companies. And I don't understand why we're paying for Stephen Hemsley to become more than a billionaire. The owner of or the CEO of United Healthcare.
I know everybody should make the same. And live in
let's just take Medicare and make it available to everybody.
You'd get along great with Obama. I thought we were going to talk about the fact that you said you can't be Catholic and be a Republican, which was an outrageous thing to say, but I guess that's why you said it.
Well, I don't think that...
That's when I approached your producer, and that's what I said I wanted to talk about. You come on with the World Bank.
I was halfway through my sentence. I was going to say the World Bank and the Pope are talking about these issues.
The World Bank and the Pope, okay. Yeah. But I'm not talking about what the Pope said. I'm talking about what you said. You said you can't be Catholic and be a Republican, did you not?
I think that's true.
What do you say to the millions of Catholic Republicans? They don't exist?
I would say that they're probably not practicing their faith the way that their Pope understands it.
Okay, so you know best on how they should be practicing their faith. Obama knows.
No, I have an opinion.
We should have our health care.
I don't know if I know best or not. I'm not Catholic, and I'm not recommending that people do anything about it. I'm simply offering an opinion.
He can put you on the bench.
I'm simply offering an opinion.
Put you on the bench. You fit right in. You know what's best. You know how people should worship their religion. He knows what people should do for themselves and for everybody else. Well,
Steve, if you are trying to rebut the concept of judicial review, that the Supreme Court has become basically the kings of America. They actually have more power than any of the kings or queens of Europe. And if you're saying that they shouldn't have that kind of power, that they should not be able to strike down laws passed by Congress and signed by the president, I agree with you.
See, even though we agree, that's not what I'm saying. Even though you
that's not what you're saying.
No, even though you think we agree, I'm not saying I agree. I wasn't talking about that. Why do you always change the subject?
Well, I thought I was following your metaphor, Steve.
You said that people can't be Catholic and be Republican. And when I say, what about the Catholic Republicans, millions of them, you say they're probably not practicing
I'm not denying the reality of Catholic Republicans. What I'm suggesting is that somebody who is voting Republican and believes that they're practicing the Catholic faith is doing so in a way that's inconsistent with the current Pope. That's what I said. I'm not. That's why I said I'm
not. It's really a mockery. Why don't you tell Muslims how they're practicing? I bet you wouldn't be doing that.
Well, I don't know. We'll have to try it sometime. Steve Malzberg. His website, malzbergtalk.com. Thank you, Steve.
Thank you, Tom.